My name is Dr. Charlotte. I'm with Alpine Fit Physical Therapy in Boulder, Colorado, and today we are going to be talking about knee arthritis. So it's something that everyone deals with. It's actually a very normal part of life. Even if you're 20 years old, you have some form of arthritis. It's probably very mild, but that will get more severe as we go through the lifespan. So questions that we like to answer for patients are: one, how can we prevent arthritis? And two, how can we manage the pain from arthritis? So getting into arthritis at its root cause, some of it is genetic, which unfortunately we can't get past, but a lot of it as well is influenced biomechanically. So what that means is basically our joints and our bones are not moving appropriately on each other. So a very common knee injury is patellar maltracking, which means that our patella is shifted outside of the femoral groove and kind of running along this lateral part of our knee, as well as kind of really diving deeper into the groove when it pops back in. That can create arthritis on the outer part of the femur as well as behind the kneecap. Another biomechanical component is if we are in knee valgus or varus. So what that means is if we have weakness in our hip and our knee tends to dive in a lot of times, we're really loading our lateral compartment of our knee. That is going to cause arthritis to form there. Another component that can contribute to arthritis in the knee often stems from the hip and weakness here. So if we are weak at our hip, we tend to dive our knee medially or inward, which is a position we refer to as knee valgus. When we are in knee valgus, we are stressing this lateral portion of our tibia and our femur, and then the opposite of that would be our knee kind of diving out, which stresses the medial compartment of that same area. So another great visual is if I'm going like this into valgus with my knee, I'm really crushing this outside part of my knee, the lateral compartment. If I'm going into varus, coming out with my knee, I'm really crushing this medial compartment. So a big part of being preventative about arthritis, but also how to control pain with it, is making sure that these joints are moving correctly and working together as a complex, which oftentimes stems from muscle tightness and weakness, and addressing both of those to make sure that we're not going into knee valgus or varus and our kneecap is properly seated in our femoral condyles so that we're not creating extra irritation and stress on the bones.